Well, that's an appropriate moment to check in with two of our good friends of the programme, isn't it? Because after a 2-week break for the Olympics, we're joined once more by the dream team of Linda Bauld, who's Professor of Public Health at the University of Edinburgh, and virologist Dr. Chris Smith. Morning. Good to see you both again.
Good morning.
It hasn't been the same without you. It's good to catch up. Should we just let's just take a snapshot, because it feels like we've all been thinking about the Olympics and summer holidays, and the weather was quite good for about 5 minutes. Here we are, Monday morning, back to relative normality. Where is the UK COVID-wise, Chris? Because we had good news and then maybe not so good news. Where do we stand?
Well, cast your mind back to June, which was going to be the original Freedom Day. At that time, we still had quite high rates of virus, and we had relatively lower rates of adult vaccination. So a case was made, let's wait 4 weeks, because this will give us time to catch up, more people getting double jabbed. Remember, the Delta variant, which is the dominant strain of coronavirus now circulating in the country, accounting for 99% of cases, that needs 2 doses of vaccine, which was the case made for July the 19th to be Freedom Day. When that came, people were concerned that there might be a very big surge in cases, because the more people did, the more contacts between people, the more people were on public transport, going back to work and so on. The more contacts means more transmission opportunities for the virus, and that would lead to inevitably more cases, more hospitalisations, possibly more people passing away. Actually, there was an increase. Remember, it reached about 60,000 cases per day, and then the corner was turned and it began to slip back, and it slipped back and then went back to about the low to mid-20s. And that's sort of where we're hovering at the moment. And if you think about this in terms of a seesaw, there are things we're doing which are helping to mitigate tipping the seesaw against us, and there are things that the virus is doing that are tipping it the other way. And we're sort of in balance at the moment, because the better weather, allegedly, means it's harder for the virus to transmit. It's easier for people to keep their houses, homes and workspaces ventilated, because it's warmer outside, so you can keep the doors and windows open, so that helps. More people are on holiday, they're not in the workplace, and schools are off, and all these things are reducing contacts between people, and I think people are continuing to be sensible. But the key thing to remember is, what's the level of people going into hospital? What's the level of people who are passing away? Those numbers remain very, very reassuringly low. And this is the evidence we have, really, that these vaccines work incredibly well. They're protecting people at the level of, say, 95 to 96%. So you're 20-fold lower likelihood to have a problem with the virus now than in the period before we were vaccinating people. So what we're seeing now is a sustained level of transmission of the infection, but chiefly among people who are not vaccinated or, as yet, younger people. But we're not seeing that translating with the same degree into casualties and consequences with people losing their lives. So I think we're beginning to see a really positive development here, where the vaccines are really helping to protect people, but we're going to have to tolerate some degree of transmission of the virus through society, because the vaccines can't completely prevent transmission.
OK, I will come back to you, Chris. Linda, let's also talk to you specifically about the changes, because there are big changes, actually, in Scotland from today. We were talking to the First Minister, and she was very much still talking about caution, actually. So just tell us about the changes and what kind of impact you think they'll have.
Yes, well, I've just been out earlier this morning for BBC Scotland, and there were people still in the street who'd obviously come out of the nightclubs, which, of course, just opened yesterday. So there's a big shift for Scotland. So we're removing almost all legal restrictions. I guess the key difference with England, for example, is that the face coverings will still be required, mandated in public places. And also when our schools go back, some schools going back next week, some the week after, children and teachers will be required to still wear them, and teachers to distance from children. So there are some differences around different parts of the UK. But just to reflect and add to what Chris has said, but specifically for Scotland, Louise, we've made really good progress up here. We were up to around 400 cases per 100,000 at the beginning of July. We're now down to about 140, a reduction of 2/3. Hospital admissions started to drop around the 19th of July and are now really quite low. And even the low numbers of deaths that we've seen, low as Chris says, because of the vaccine, even those are actually reducing. So we're in a good trajectory. And as we open up and move around, we expect, like in England, a little maybe uptick in cases again. But we're hoping that those other indicators will remain stable. And then we can plan for what will probably be a bit of a bumpy road in the winter. But for today, really important day for Scotland, and we're all feeling quite optimistic here.
Linda, I'm just imagining what you were thinking when you saw those young people heading home from the nightclubs as you're on the street this morning. What, as a human being, but also as an expert in public health, what's going through your mind?
I think, first of all, I'm just delighted. There's young people in our household as well, and it's been really, really tough for everyone who has been not at zero risk from this virus and the disease, but at much reduced risk. So that's very, very positive. On the other hand, I recognise that when households are mixing and in nightclubs, face coverings are not required. Obviously, people will be relaxed, enjoying themselves, and the virus hasn't gone away. We've still got about 1 in 120 people, the ONS estimates, with it in Scotland, and that's why I do expect to see some more cases. The other thing I think, John, when I'm looking at those young people, is just hoping that even more of them will come forward for their vaccines. And of course, we have seen a very good response, including, as I'm sure we'll come on to discuss, from teenagers who are now eligible. But I just hope when I go back, start teaching students again in a few weeks, I'm really hoping that we can continue to send the message as an evergreen offer for the vaccine. Please do take it up.
I'm interested as well, both your opinions. Actually, we'll go with you, Chris, first, about this sort of idea of giving, young people, particularly, sort of incentives to get the vaccine. Does that, in your view, does that work?
Well, it's worth a try. There's an important target here, which is that there are about 3 million younger people under the age of 30. It's about a third of people in that particular age demographic who have not sought out vaccination. And these are regarded as an important target in order to help protect them, because these are the individuals who are more likely to be at work, they're more likely to be at college, they're more likely to be at school, they're more likely to be on public transport. And along with Linda, I'm sure you were there last night, Linda, at those nightclubs. And so as a result, you've got more transmissions occurring in that group, and the onward transmissions in that group mean you've got an amplifier to spread infection. And they may not be necessarily at high risk of succumbing to the consequences of coronavirus, but they can give it to people who are. And although these vaccines can't block completely the transmission of the infection, what they can do is to slow it down, at least for some people. And if you do go on to catch coronavirus and you've been vaccinated beforehand, you will certainly have what we call an attenuated attack, a lower risk of severe disease or less intense disease. So it's a good idea for these individuals. They're a big group in society, they're a big spreader, and therefore if we can encourage uptake in that group, that's a good thing.
Linda, I suppose one of the issues facing those young people might well be that a lot of them have had COVID, or are pretty sure they've had COVID, so they might think, well, why do I need to be vaccinated because I've already got the antibodies? What do you say to somebody in that position?
Well, that's a common thing that you hear. And just to add, if I turned up at the nightclub, Chris, I think I would have had an empty dance floor quite quickly. They would have been horrified. But anyway, it's a genuine question. Does prior infection provide protection? And of course, it does to a certain extent, in that we know from studies you produce antibodies when you've had an infection, and therefore there may be some protection. And that's why we say to people who take a PCR test, don't take another one for at least 90 days, because some of that genetic material from the virus will still show up. But what we know is that vaccination provides a much more robust and potentially long-lasting form of protection, particularly importantly for 2 doses. So I think we can reassure young people that it's much better to build up immunity through vaccination than through infection. And just on the incentives specifically, which is an area I've done some research on myself, I think it's really interesting. We've heard the University of Sussex, of course, having competitions for students. If they've been vaccinated, a lottery, they can put their name in a hat and win a prize. I don't think they will have a big impact on the uptake of vaccines, but we've seen that used extensively in the US, and incentives can sometimes prompt behaviour change. So I wouldn't rule them out. I think anything we can do to encourage more uptake is a good thing.
Can we just also look ahead, Chris, start with you, about plans for the autumn? You sort of intimated that things could be changed a little bit in the autumn. And what about flu? There's discussion around flu coming, perhaps having a bad year as well. What can you tell us?
Well, we know that in the autumn, all the usual seasonal suspects will rear their ugly heads again, with people going back to school, people going back to work, the weather closing in. This facilitates outbreaks and spread of infectious diseases, and we see that every year. And we're expecting this year to be no different. But of course, superimposed on that will be the risk of more coronavirus cases, but also flu. And flu has gone very quiet. Because of the measures we've taken to stop the spread of coronavirus, we've seen very few cases of flu around the world. And this is doing two things. One, it means that because people are not catching it, they're not topping up their natural immunity to flu, so there are more vulnerable people in the population. But two, we normally have a big network of thousands of laboratories collecting samples of the flu all around the world, all through the year, which are fed back through the World Health Organization to work out what do we do about the vaccine. Now, because flu's vanished off our radar screen, we're much more resorting to guesswork in terms of what the vaccines are going to have to do this year for flu than we would normally do. So we think there's every reason to be more worried about the flu in perhaps this year or into next year. And it's for that reason, because there is a bigger risk of the flu, that they're urging everybody to get vaccinated, because vaccine does nevertheless confer some protection, even if it's not a perfect match with what turns out to be circulating. But because of the risk of a higher rate of circulation of the flu, getting a flu jab as well as a coronavirus booster jab, which the JCVI have suggested should apply to everyone over the age of 50, starting in the autumn. And we gather that pharmacies and chemists will be able to deliver a sort of double shot, one in each arm, a flu jab and a COVID booster. I think this will be very good practice going into the autumn, because it will make sure everybody is as protected as they possibly can be, and that will help to safeguard against pressures on the health service.
And Linda, obviously things change on an almost daily basis, don't they? But looking at the situation now, how confident are you that we can avoid any more lockdowns this autumn and winter?
Well, none of us has a crystal ball, John, and we're always discussing how far ahead can we look. I think there's a number of factors at play here. First of all, I would say I'm hopeful that that will not be the case. I think we will see, for example, outbreaks or surges in localities, and we may need to take a more targeted local approach. That's one possibility. I think if we're with the variants that we currently have, and we don't have a new significant variant of concern that really does challenge the vaccines, bearing in mind that none of the variants we've seen so far have really challenged the vaccines to the extent that the vaccines do not protect against severe disease and mortality. If we did see one in the future that raised questions, we would have to change our vaccination program. We might have to reimpose some restrictions. But I think the UK and a number of other countries is really looking ahead to the coming months and saying, well, we're going to have a difficult winter, but if we can get through this looking ahead to next year, I think we really will be emerging from a pandemic, which is an immediate risk to health to everybody in an area, to an endemic situation with this virus. And that's what all of us hope, while keeping up, of course, as Chris was just saying, we're probably going to need vaccines and boosters for the foreseeable future.
OK, look, thank you both very much indeed. It's great to check in and hear your expertise again. And Linda, we'll let you get back to the clubs now, because some of them are staying open all day, I think. So, yeah. Doesn't look convinced. Thank you very much indeed.
I'm tempted. Now.